Right now, a silent, deadly virus is spreading across America, and most people have never even heard of it. It is not on the evening news, and your doctor has probably never once mentioned this disease to you personally. But CDC data confirms that nearly 1 in 2 people who develop its worst form will simply not survive it. Nearly 50% of severe cases end in death, often within just 48 terrifying hours of first symptoms beginning. Adults aged 60 and older carry the highest risk, and most of them have absolutely no idea about this danger. If you have cleaned a garage, or opened a shed, or spent time near a cabin, please keep watching this now. What I am about to share may be the most important health information you receive during this entire year, right here. I have spent decades researching how infectious diseases attack the aging body very differently than they attack younger, healthier bodies everywhere. This virus is called Hantavirus, and it has lived silently inside rodent populations across this entire planet for thousands of years. Most people have never heard its name because, unlike the flu, it does not spread from one person to another person. It lives inside deer mice, which carry it constantly in their saliva, in their urine, and in all their droppings. The rodent never gets sick, never shows any symptoms, and gives you absolutely zero visible warning that it is infected today. It simply lives its daily life, leaving invisible trails of one of the most lethal viruses ever known to modern medicine. Those invisible trails exist right now, in garages, attics, barns, sheds, and old vehicles spread across every region of this country. The primary way this virus enters your body is not through a bite or touch, but through the air you breathe. You breathe it in, and by the time you realize something is wrong, it is often already far too late, unfortunately. When infected mice leave droppings in enclosed spaces, those particles dry out and become microscopic, invisible dust floating in the air. The moment you walk in, sweep a floor, or shift a dusty old box, you inhale those invisible, dangerous particles directly. They travel down your airway, bypass your defenses, and reach the deep, most vulnerable lung tissue inside your aging body now. Once inside the warm environment of your own lung cells, the virus begins quietly doing the most devastating work imaginable there. Research in emerging infectious diseases confirmed that hantavirus particles can remain alive and infectious inside any environment for several full days. In cool, dark, sheltered spaces, like sealed barn walls or old closed cabins, those same dangerous particles survive for even longer periods. Here is what makes this especially frightening for any adult who is 60 years old or older, so please listen carefully. After age 65, the tiny structures lining your airway that trap foreign particles weaken in their efficiency by 40%. These structures, called cilia, normally sweep out dangerous particles before they can ever reach the deep tissue of your aging lungs. But natural aging slows those cilia until they simply can no longer perform that critical life-saving protective sweeping function properly. What a healthy 35-year-old clears before reaching the lung, a 68-year-old simply allows to go deeper. This is published research from Johns Hopkins University School of Medicine, and it carries very serious real-world consequences for you personally. Your aging body is simply far less equipped to stop this virus at the door before it reaches your most vulnerable part. Now, I want to walk you through exactly what this virus does once it enters your body, step by devastating step, today. After you inhale the virus, nothing happens immediately, and that long silence is itself one of its most dangerous and deceptive features. The incubation period, meaning the window from exposure to first symptoms, ranges anywhere from 1 full week to 8 full weeks total. You can feel completely fine for 2 whole months while this virus quietly multiplies inside the cells lining your own blood vessels. Those cells, called endothelial cells, are the thin walls that keep blood inside vessels and keep fluid exactly where it belongs. As the virus replicates inside them, it makes those walls increasingly weak and leaky and unable to hold fluid in place. The first symptoms feel almost exactly like a bad flu,
which is precisely why so many experienced physicians initially misdiagnose this illness. Fever, deep muscle aches in the thighs and back, intense fatigue and headache mark the beginning of this very deceptive phase.
Even an experienced physician, not specifically thinking about hantavirus, would likely assume influenza or some other ordinary, everyday, common viral illness instead. This is the phase during which the virus quietly destroys structural integrity of your blood vessels in ways that will soon devastate you. Within 4 to 10 days of first symptoms, the disease shifts into what doctors call the cardiopulmonary phase and escalates fast now. As blood vessels in the lungs become increasingly leaky, fluid begins flooding directly into the tiny air sacs of your lungs. Your lungs, which should feel light and airy like sponges, begin filling with fluid, just the way a submerged sponge fills completely. Breathing becomes harder, then harder still, until suddenly you simply cannot pull in enough air, no matter how desperately hard you try. Your oxygen levels plummet, your blood pressure drops, and your heart, now starved of the oxygen it desperately needs, begins to fail. This condition, called Hantavirus pulmonary syndrome, can escalate from the first sign of breathing difficulty to complete respiratory failure within 24 hours. Many patients go from feeling like they have a simple flu to lying on a ventilator inside an ICU within 1 day. There is currently no antiviral medication approved to treat hantavirus, and absolutely no prescription your doctor can write that targets it directly. Treatment is entirely supportive, meaning oxygen, ventilators, IV fluids, and skilled ICU nurses monitoring every single vital sign around the clock, tirelessly. This is exactly why I am speaking with you today, before you or anyone you love is ever placed in that position. Let me tell you about real people this has happened to, because I need you to feel that this is not theoretical. In the summer of 2012, visitors sleeping in tent cabins at Yosemite National Park unknowingly slept inside contaminated, infected spaces. 10 people were confirmed infected in that single outbreak, and 3 of those 10 people died from hantavirus pulmonary syndrome that summer. The CDC launched a massive formal investigation and had to notify thousands of past visitors who had stayed in those very same cabins. The cabin wall insulation had been fully colonized by infected deer mice, and nobody knew until people started becoming critically, dangerously ill. More recently, a retired man in his early 60s spent 1 full weekend cleaning out a storage barn unused for several years. He wore no respiratory protection because he had cleaned similar spaces dozens of times before and never thought about hantavirus exposure once. Within 2 weeks, a stubborn cold became severe pneumonia, and 48 hours after hospital admission, he was placed on a ventilator. He survived only after 18 grueling days in the ICU, followed by 8 long and very difficult months rebuilding his breathing capacity. He later told his physicians that his lung function never fully returned to what it had been before that one fateful cleaning weekend. In Argentina, a 2019 Andes virus outbreak infected 29 people in one province and tragically killed 11 of those infected. What alarmed researchers worldwide was the shocking fact that the Andes strain can spread directly from one infected person to another person nearby. A healthcare worker who carefully cared for infected patients in that outbreak was herself later infected through close personal contact with a patient. The World Health Organization issued a formal public health advisory in response, and scientists have since closely watched that frightening strain with great concern. In Colorado, Utah, and New Mexico, the historic epicenter of North America, hantavirus public health departments confirm brand new cases every single spring season. In 2023, Colorado confirmed 3 hantavirus pulmonary syndrome cases, and 2 of those 3 cases involved adults over 65. One of those adults did not survive, and I want you to let that reality fully land, because that person had a full life. Now, I want to give you 5 critical steps every adult over 60 must take, starting this very week and not next month. I am counting from 5 down to 1, and you must stay until number 1 because it is the single most critical step.
Most adults in your age group are not doing number one, and the reason why is going to genuinely and deeply surprise you. Number five is this: perform a complete, thorough rodent inspection of every single enclosed space on your property before this week fully ends. That means your garage, your basement, your attic, your garden shed, any outbuildings, your crawl space, and every vehicle sitting unused for any period.
Look for droppings resembling small dark grains of rice, for gnaw marks on wood or plastic, and for shredded nesting materials anywhere inside. Also, look for grease marks along walls where rodents travel repeatedly, and for the distinctive, very musty odor that signals active rodent presence. Before entering any enclosed space, open every door and window first and allow fresh outside air to circulate for a full 30 minutes. Never sniff inside enclosed spaces, never disturb anything with bare hands, and never conduct this important rodent inspection completely alone without someone present. Research from the University of New Mexico found that 12% of all deer mice in rural southwestern American areas carry hantavirus. That means 1 in every 8 mice in those regions silently carries a potentially lethal virus with absolutely zero outward visible symptoms whatsoever. After the age of 70, your innate immune system, the force that immediately attacks incoming pathogens, operates at only 40% of efficiency. That is real, measurable immunological decline, meaning your aging body now has far less biological margin for any kind of infectious error. Number 4 is this: proper personal protective equipment is absolutely not optional when entering any enclosed space with signs of rodent activity present. You must wear a certified N95 respirator, not a surgical mask, not a cloth mask, but a true N95 that fully seals properly. Standard surgical masks allow air to flow around their edges, and hantavirus particles are small enough to slip through those gaps with every breath. A properly sealed N95 respirator filters at least 95% of all airborne particles and gives you the real protection you actually need. You also need disposable nitrile gloves for your hands, and ideally old protective clothing you can immediately bag and wash thoroughly in hot water. I know this can feel like total overkill for cleaning your own garage, but please consider this one very honest comparison before dismissing it. An N95 respirator and nitrile gloves together cost between $15 and $20 at any hardware store you can very easily visit today. A single day inside an American intensive care unit costs between $3,000 and $10,000, and that covers only one single day. No amount of money and absolutely no medicine anywhere in the world can restore the lung function destroyed by severe hantavirus pulmonary syndrome. After 75, your body has already lost approximately 35% of its pulmonary reserve, your total emergency backup breathing capacity during stress. That reality makes wearing proper respiratory protection not just a simple precaution, but a genuine act of intelligent and careful, life-preserving self-care. Number 3 is the most dangerous and most common mistake I have consistently seen adults make when discovering any rodent activity on their property. The most harmful thing you can possibly do after finding rodent droppings is grab a broom and dry sweep them right off the floor. Dry sweeping or vacuuming droppings launches virus particles directly into the air immediately around you, turning ordinary cleaning into a potentially fatal, terrible mistake. You create an invisible cloud of infectious material and then breathe it deeply and directly into your own completely unprotected and aging lungs. The CDC protocol begins by thoroughly wetting the entire contaminated area first with a proper disinfectant solution before touching absolutely anything else there at all. Mix 1.5 cups of regular household bleach into 1 full gallon of clean, cool water to create an effective disinfectant solution. Spray this generously over all droppings, all nesting materials, and all surrounding surfaces, and allow the solution to soak for at least 5 minutes. Then, wearing your properly fitted N95 and your gloves, use paper towels to carefully pick up all the dampened material without any rushing at all. Seal everything inside a sealed plastic bag, then seal that bag inside a second bag, and dispose of both in a covered outdoor bin.
Wipe all rodent-traveled surfaces with the bleach solution, mop all hard floors completely, and steam clean any carpet or any fabric surfaces present. This wet cleaning method reduces your personal exposure risk by an estimated 90% compared to dry sweeping, according to official published public health guidelines.
For an aging immune system that cannot compensate the way it once easily could, this protocol is the true difference between exposure and real safety. Number 2 is the specific piece of information I believe could most directly and immediately save your life or someone you deeply love today. You must memorize the exact symptom combination demanding an immediate emergency room visit, and not urgent care, and not a call scheduled for tomorrow. The warning pattern is fever above 101 degrees, combined with deep muscle aches, specifically located in the thighs and lower back. Add to that any degree of shortness of breath that progressively and clearly worsens over hours, even if it initially feels mild and manageable. If those 3 signs appear together after any rodent exposure in the past 1 to 8 weeks, go directly to the emergency room immediately. When you arrive, say clearly and loudly to every staff member, "I may have been exposed to hantavirus and I cannot breathe well now." Do not assume the physician will automatically connect the dots, because in a busy emergency room, hantavirus is almost never the very first diagnosis. You are your own most important medical advocate in that critical moment, and the words you speak when you arrive will affect your survival. Research in the Annals of Internal Medicine showed that patients who communicated rodent exposure within 24 hours had dramatically better overall survival rates. Early recognition means faster access to ECMO machines, which are artificial lungs that breathe entirely for you while your own body fights to recover. It also means faster transfer to facilities with intensive supportive care technology, giving critically ill hantavirus patients their absolute very best possible survival chance. After 65, a phenomenon called inflammaging means your body's own internal warning signals may actually feel far weaker than they biologically truly are. Your inflammatory response, the inner alarm system that signals something is seriously wrong, becomes significantly slower and far less reliable as you continue aging. You may therefore feel much less sick than you actually are, which leads many older adults to dangerously minimize symptoms that are truly critical. Take every single symptom completely seriously. Act faster than your instincts say to, and never delay when you know rodent exposure has occurred recently. Acting early costs you only one brief ER visit and a few tests, while waiting even a few hours could cost you absolutely everything. And now, number 1, the single most powerful protective step every adult over 60 must take, and the one almost nobody is currently doing. It is not the N95 mask, not the wet cleaning protocol, not the symptom list, though every one of those things genuinely matters deeply. Number 1 is this: have a direct, specific conversation with your own primary care physician about your personal hantavirus risk before going near rodents. A 2022 survey by the American Geriatric Society found fewer than 8% of adults over 65 had ever discussed this topic. Fewer than 8%, meaning more than 90% of all older adults have never once raised animal-transmitted disease risk with their own physician. This is number 1, because your physician can do something for you that no amount of protective equipment or any cleaning protocol can ever replicate. They can assess your individual immune status and check whether current medications are silently suppressing your immune response in ways completely unknown, even to you. Certain antihistamines, corticosteroids, and blood pressure medications can significantly weaken immune function, making you considerably more vulnerable to this dangerous and deadly viral infection now. Your physician can also formally note your hantavirus risk on your chart so that emergency room staff immediately recognize it and act on it. That one notation could mean the difference between immediate, correct, life-saving testing and hours wasted investigating entirely wrong diagnoses during your most absolutely critical moments. There is no hantavirus vaccine, and no preventive antiviral medication exists anywhere. But your own physician can become your most powerful living early warning system. Print the key facts from this video, take them to your appointment,
and tell your doctor you want to discuss your hantavirus risk today. Tell your physician exactly where you live, what kinds of spaces you regularly enter, and whether you have found any recent signs of rodent activity.
That one conversation for a person in rural Colorado or someone who summers in a mountain cabin could genuinely and truly save your entire life. Combine this physician conversation with your rodent audit from step 5, so you arrive with real, specific, concrete information about your actual personal exposure risk. A patient who arrives prepared with specific details always receives far more thorough, targeted, and effective medical attention than one arriving with only vague concerns. Here is what I want you to carry away from today. Not fear, not anxiety, but complete clarity and a very specific, actionable plan. You now know what hantavirus is, how it spreads, and exactly why aging bodies are so much more vulnerable to its most devastating effects. You know how it progresses, from a completely silent, invisible infection to life-threatening respiratory failure that can fully unfold in under 48 hours. You know what real documented cases have looked like. Real people, real families, and real permanent life-changing consequences that absolutely nobody anticipated or prepared for. And you now have 5 specific and actionable steps to begin executing this very week that will meaningfully reduce your risk and your family's risk. Do the complete rodent audit of every single enclosed space on your property and get your N95 and gloves before entering any contaminated area again. Follow the wet cleaning protocol exactly as I described, because the critical difference between dry sweeping and proper wet disinfecting could genuinely save your entire life. Memorize the 3-symptom warning combination demanding emergency care, and never once minimize those signs if any rodent exposure has occurred within the past 8 weeks.
Have that physician conversation this week. Not eventually, not someday, but specifically before this summer rodent season reaches its most dangerous and highest risk annual peak. Your independence matters deeply to you. The ability to open your own cabin each spring, to work freely in your shed and on your property. Those activities are not trivial at all. They are the living, breathing proof of a full and active life in your 60s, 70s, and 80s. It does not matter that you have entered enclosed spaces 100 times before without any protection and never once thought about hantavirus until today. Starting right now, with the knowledge you now carry within you today, you can fully and completely change what happens next for yourself. Your longevity is not only about what you eat or how you exercise. It is also about the invisible threats you now know to face.
Today, Hantavirus moves from a name you had never heard before to a genuine threat you fully understand, deeply respect, and are completely prepared for. That is the entire difference between remaining vulnerable and becoming truly protected. And you made that powerful shift simply by choosing to watch this today.